Good morning. Thanks for having me. And I couldn't imagine a better talk before my brief 10 minutes from Dr. Oji Kutu. And you'll see she talks about a community engaged public health approach. And I will be talking about a community engaged research approach. And so we'll take it and run. Great. This is about the healing community studies and the reality, or some of the reality, of implementing community engaged protocol in local settings. So in this brief period, I'll outline the goals and structures of this large NIH study, healing community study, and explain how the Massachusetts site adapted this structure to implement our interventions in local communities. So what is the healing community study? I'll give you a couple of background pieces on it. In April 2019, so 4.5 years ago, NIDA and SAMHSA funded 4 states, Massachusetts, New York, Ohio, Kentucky, to work with 67 highly affected rural and urban communities to reduce opioid overdose deaths by implementing a process to deliver evidence-based practices, EBPs we call them, evidence-based practices, in healthcare, behavioral health, and criminal legal settings. Okay, so this is a randomized controlled trial that you'll see, but the unit or the participant were the communities, the 67 communities. So the design of the study, it's a mouthful, a multi-site, parallel arm community randomized controlled trial evaluating the impact, and I'll tell you about it a little bit, of the communities that heal, the CTH intervention, and intervention communities, which we call Wave 1 communities, compared to usual care that was going on in waitlist control Wave 2 communities. Okay, in Massachusetts, I'm not going to talk about the other 3 states, but this was one large study, but I'll just focus in Massachusetts. 16 highly affected communities were identified, 362 combined annual overdose deaths, and opioid overdose death rate of 40 per 100,000 individuals. If you're into these numbers, 40 is quite high. So they were highly impacted individual. And you can just see here, there were communities across Massachusetts. The hatched communities are the rural ones. The orange ones are the Wave 1, the communities that in the randomized controlled trial received the intervention. HCS goal was clearly to reduce opioid overdose deaths. That's the primary outcome of the study. And how to do that was to try to implement strategies that we know work. We know it's been proven to reduce opioid overdose deaths. So increase overdose education and naloxone distribution, Narcan you've heard about, reducing the overdose. Increase access to medications for opioid use disorder, referred to as MOUD, and increase safer opioid prescribing and dispensing practices. So these were the evidence-based practices that communities were to implement to achieve the goal, decreasing opioid overdose deaths. Just a word on the communities that heal, since this was the intervention. The intervention was an approach to get communities to adopt what they saw as important for their own communities, evidence-based practices. So finding results in studies, as we all know in the CTSI world, don't always get down to individuals into individual communities. So what is the CTH? Well, it was 3 pieces that you see in this Venn diagram bit. But community campaigns was one of the big pieces. So really communication campaigns. So these were campaigns that talked about the value of naloxone, reducing stigma with people with opioid use disorder that we heard in the last talk, and about medications for opioid use disorder and reducing the stigma for that. Community engagement was a pillar, one of the 3 pillars of the healing community studies. And it involved a community engaged process. So I'll go into a little bit of, and it was how the communities created coalitions, created charters for coalitions, and then decided looking at data, what was best for their community. There was also a menu of evidence-based options for reducing overdose deaths. So those are the three pillars. But the key was that the local communities and the intervention communities would decide what best fits their needs. And they would decide based on looking at the data for their community. Also, along with this, is they would decide how to spend the $800,000 that these communities got each year for 2 years. Brief period of time, but. So I'm going to speak a bit, because this is the focus of the CTSI here, about community engagement as it played out in this study. Data-driven decision-making processes to select evidence-based practices. So that's a nice phrase. What does it actually mean? And how do you get communities to look at their own data? You can show it to them, but how do you get them to then discuss it and digest it and have it play into the decisions they make? Well, this was new stuff to me. I am a longtime addiction researcher, but community engaged research, I now have 5 years under my belt with this study. So I've learned as we've come down this path. But data walks, engaging communities with data to assess the gaps, what's missing in their communities, and the opportunities, what might help. And then another process called photo voice, where you engage people with lived experience with drug use to understand the contextual drivers of the opioid epidemic and what might be needed for their community. So I'm going to give you a couple of examples. In Springfield, one of the Wave 1 communities, they had a data walk where they saw this data. This data was presented to them, and it looked at 2020, 2021, 2022, opioid rates per 100,000 among their residents of opioid overdose deaths. Springfield, a highly impacted community. And you could see in the beginning, Hispanics in Springfield were disproportionately affected, and then Blacks actually less so. And then over the 3 years, things changed. I won't walk through the change, you can see it, but the notable point is how increase in Blacks in Springfield was striking. So the community saw this data. Using this data, they decided that part of their strategy would be to address disparities in these fatal overdose trends by sponsoring 8 Black individuals to complete the Recovery Coach Academy. So these are individuals that would get training in helping people with substance use disorders and then go in the community and address them. I'm just pulling out another example. There's many, but I'm sharing a few. Belchertown Ware was a rural cluster of community where they did this photo voice where the pictures were taken and then discussions were held around those pictures and themes were derived from those discussions. And this theme, based on this picture, was lack of transportation limits access to opportunity and recovery resources. Big message that one hears in rural communities when you're talking about substance use disorders. And the quote here was, "Without a way to get to a job, I can't make the money I need to fix it, the Jeep. And it keeps me in the cycle of never being able to get my feet under me." In response to this, the coalition Belchertown Ware decided to get recovery coaches to provide low barrier peer transportation. So they actually staffed 2 full-time recovery coaches, and part of their activities were to get people with MOUD to their appointments for medications. One other part I mentioned was communication campaign, and this is just examples in one of the communities. The communication campaigns had themes. So it's about naloxone, the value of it, MOUDs, the value of that, stigma around those things. But I just show you these because these were ones about naloxone, sometimes on buses, sometimes in the internet. But these were people in the community who said, I want to be recognized so that this resonates with our community. It's not just people that taken from elsewhere. These are us. This is our community. And finally, racial equity and social justice was looked at and was a key theme in looking at our communities. And this was somewhat done by data, as we just heard about how important data is in the city of Boston. This was Brockton residents looked at the opioid overdose trends between 2017 and 2020. And basically what you can pictorially see here is that in that period of time, the deaths among Black individuals from opioid overdose is strikingly increased. As a result of seeing that data, the coalition in Brockton decided that it was time to focus on naloxone education and awareness, and doing that by going to Black-owned pop-up shop event, engaging with the Cape Verdean Association and getting on their radio station to try to decrease stigma. And the Haitian Community Radio Show was another way where similar efforts were made. So these efforts to engage the community had consequential results. So in conclusion, coalition-driven process supported localized implementation of study intervention, engagement with local data on their community risk and what their gaps were, help inform intervention strategy, and putting a local face of community champions on the campaigns helped reduce stigma. Thank you. Transition or question?
Does this work? Yeah. So we have about 2 minutes for questions. So maybe one question too. Jeffrey?
Hi, my name is Dora Free. I'm representing CTSI, Canada, representing companies, but also the nonprofit organization, Beyond Health. And I'm curious, how did you identify those specific groups of to engage? So the Cape Verdean radio station. And have you also thought of engaging faith-based alliances to destigmatize naloxone or other forms of treatment?
Great. I think I heard most of your question.
I can
repeat
it.
No, but that it was, how do you engage people in the community of different areas, particularly faith-based?
How did you identify which ones that you already have worked
Right.
with? And then have you thought about faith-based alliances?
Right. So the identification, there's different levels of identification. The communities that were chosen, which I don't think was your question, but within the communities, how do you identify who's part of the coalition? And I would say some of the early work when the coalition was called together, and part of the motivation of calling them together was because there was money on the table that could be used to address what was clearly recognized as a community need. But then this was working with the research team, was working with the community coalition, but the community coalition did the real work, but the research team would emphasize themes. So what you're getting at is it might emphasize the theme that maybe the whole community is not represented. Maybe you don't have people with lived experience here. Maybe you don't have the faith community here. It was not saying you have to, but to make your best community coalition to best come up with solutions for your community. And especially when we show him the data walk of who is being impacted, well, we need more people represented from these groups. And so that's at least an explanation of how that process worked. Okay.
Great talk. Could you go back to the slide on deaths that you showed by ethnic background? No, back even more. That one. If you look at this, it looks like you did a remarkable job on getting Hispanic deaths down. What did you do that was right? Whites, kind of that's variation around a mean. And you've got this increase in Blacks, but it's actually 72. So you went from 75, 76, 72. So Blacks actually remain stable. They didn't go up. So you have some success amongst Hispanics. What were you doing that was successful? And it's not that the Blacks went up, it was that they stayed stable.
So to explain my graph, which may not be totally clear, the last character over there were blacks within the 3 years, 2020, 2021, 2022. So the blacks
Yeah.
actually did go up over those 3 years. Now they went to a level, as you point out, which was similar to the level that whites were and Hispanics
it.
were in that same year. But they went up from where they were previously.